This is certainly a hot topic, and it's one of the things that I'm asked about, maybe more than any other specific disease process. So, yeah. So, Doug, I'll let you
Okay.
rip away.
Well, yeah, I'm excited to be I feel like I'm participating, though I don't have any education in this field at all. But I do have a lot of questions. There seems to be a lot written about glutathione and cancer. So, what does the relationship have to say about this relation? The literature have to say about this relationship.
Well, first of all, I congratulate you for having the courage to bring on one of the most controversial areas about the application of glutathione in taking care of our health. As you can see from the slide here, this is an area that's drawn an incredible amount of interest. I mean, almost 30,000 articles about glutathione and cancer available to you. This is the reason I say that this is controversial, is that there are very distinct and differing opinions on how to approach this. And at the very least, let me say that the literature can be very confusing. So if you're looking at the literature and you get confused, you are not alone. So let me start off by saying this. It's quite clear and agreed upon that people with low glutathione levels are at significantly higher risk for the development of cancer. This has been shown by several methods, not just measuring glutathione levels, but more recently because of our ability to look at the human genome and determine DNA coding. These studies, which look at people who have abnormal glutathione genes, show them to be particularly susceptible to cancer. This is very revealing. Now, what makes this situation even worse is that cancer itself will further lower glutathione levels throughout the body. So study after study shows that the total body glutathione is lower in cancer patients than in the healthy population. So this makes the patient's defenses even weaker. And this is further demonstrated by the strong evidence that cancer patients with higher glutathione levels have far few negative side effects from their chemotherapy and radiotherapy. In other words, higher glutathione levels improves the tolerability of the treatment, which I'm sure you're all aware is often as unpleasant as the disease itself.
Okay, so I've seen a lot of studies that have demonstrated that glutathione levels in cancer cells are actually higher than normal. So the glutathione levels in the cancer cells themselves are higher than normal. Somehow that seems counterintuitive to what you just showed us there. Can you comment on that?
Yeah, that's hence the controversy. Good question. As we mentioned before, this glutathione in cancer is one of the more challenging areas. Here is the major reason for the confusion in the literature. When you measure glutathione levels in most solid tumors, you find that these cancer cells are actually high in glutathione. Interesting. And this can lead us to coming up with contradictory conclusions. Let me explain and pay attention now. You need to wrap your head around this. This does get a little bit confusing unless you're paying attention. So we have tumor cells, cancer cells that are high in glutathione. And because the cancer cells are high in glutathione, the cancer cells use this extra glutathione to protect themselves from the chemo or radiotherapy. In fact, this has been used to explain the resistance to treatment in certain cases. This has led to a lot of research where cancer cells, you can grow them outside of the body in what we call a cell culture. And experiments are done on these cancer cells themselves. Now, what has raised a lot of attention is that if you could deplete or lower glutathione levels in these cancer cells grown in a culture, you can make them more susceptible to damage by chemotherapy.
So again, this seems to argue in favor of lowering glutathione in patients, like not raising glutathione. So why aren't we just lowering the glutathione levels in cancer patients?
Well, the reason is following: when you do that, and this has been done in many clinical trials, and this is why we must make any major decisions on treatment methods based on human trials. I say this again and again: laboratory studies and animal studies, of course, they're important to our understanding, but when you take these experiments into a human study, so often we end up being surprised because of the outcome in the real world. So this is important, Doug. When you lower glutathione levels in patients before chemotherapy or radiotherapy, you find that the side effects of the treatment are so severe that the approach becomes impractical and even, unfortunately, can result in death of some of these patients. You know, they receive a drug to lower glutathione before they get their chemotherapy. They get their chemotherapy, and their immune systems are completely wiped out. And the next person that walks into the room and sneezes or coughs kills the patients. So this is not doable. And scientists are still trying to find a way to do this, so far with very little success.
So, okay, so that begs the question: raising glutathione levels in oncology. Is this a good idea or is it a bad idea?
Well, I have to think that most well-read people would not argue much with raising glutathione in patients who are not undergoing. So if you're not going to be getting chemotherapy or radiotherapy, this is not an issue. Now, again, so you always listen to your doctor before you listen to something you heard online. Of course, this is the safe thing to do.
But what about raising glutathione levels for patients who are receiving chemo or radiotherapy?
All right, so this is a complicated question that deserves a closer look. And this is what I've been proposing to doctors and scientists for decades now. I have to tell you, this has been a long and difficult argument with the medical community. You need to start by looking at all the available literature and trying hard not to cherry pick the articles that only support your point of view. So I welcome you all to do this yourself, and especially the doctors out there. Always do your own homework. You'll find that the vast majority of the successful studies looking at lowering glutathione before chemotherapy have been in tissue cultures or test tube studies and not in live human beings. I say the vast majority. Actually, I've never found any that have been useful enough to consider using as a clinical investigation. So if anybody finds one, please send it to me. But to my knowledge, I have not seen a study where lowering glutathione before chemotherapy in a human study works. I have not seen any. So again, alert me to it if you have. And just as importantly, I've not found a single article where raising glutathione in human cancer patients backfired. None. So again, if you come across one, again, I need to know, so send it to me. So I'm asking you all, if you do your homework and you find something that shows that I'm wrong, I need to know. And to make my life easier, because I was spending so much time answering this question again and again and again, I wrote this article. And it essentially summarizes what we just spoke about, but in much more detail and with dozens of references. So please feel free to read this if you want a deeper understanding. We'll make it available to you.
So you are suggesting that raising glutathione levels in humans can improve the outcome of chemotherapy and